I understand your group runs 43 group homes. What have you been told from the government about when your residents will actually get those jabs in arms?
Look, at this point, we actually haven't heard anything. So we obviously knew that 1A, we were part of the 1A group, and we went and made lots of plans to ensure we had informed consent from our clients. But since then, we've really not heard anything.
So what is your expectation as to how this will progress?
So in the face of that, we've taken it upon ourselves to basically develop our own solution. So we're looking at taking our residential clients to their local GPs and getting them vaccinated that way. Obviously, the challenge there is that many GPs simply don't have stock of the vaccination.
Have you been surprised at the lack of communication? I mean, this sounds like major mismanagement in terms of communicating with groups like yours.
Look, it's concerning, but I can't diminish that this is a massive task and a massive challenge that the government has before them. But we absolutely do need to make sure that our clients, people with disabilities, some very, very complex, do receive the vaccination because should they contract COVID, we know that they would be one of the groups highest at risk in terms of mortality rates.
We have seen evidence given to a committee that there was a priority at one point of first getting the aged care homes dealt with and then the disability care homes. Does that make sense to you at all, or was that pretty disappointing to hear?
Look, we're glad that we were included in the 1A grouping, because the facts of the matter are that people with disability living in those residential services are living in a group setting, which means that should one of them contract COVID, the chances that other members in that same household would also contract it would be quite high. Given that there are also people with quite complex care needs, the chances, if they should then contract COVID, are that they would also, fall into the high risk category from a mortality rate perspective as well.
Yeah, and I guess the residents are one thing, and there's also the staff members to deal with as well. What are you doing in terms of the people who work for you? Are you strongly suggesting they get the vaccine? Are you considering making that a mandatory requirement?
Yeah, look, we're following government guidance with regards to our workforce. So we're obviously strongly encouraging our workforce to go out and get vaccinated, but like the government, we're not making it mandatory. But obviously, if our workforce, as and where possible, and if they're comfortable getting the vaccination, we're absolutely supportive of them doing that.